During these difficult times, we all have questions. And tonight, we begin a new weekly segment, Ask Us. We want you to submit your questions via our website and our various social media platforms, Twitter, Instagram, and Facebook. For the record, Facebook is a funder of the NewsHour. Amna Nawaz brings us some answers.
Thanks, Judy, and thanks to all of you for sending us your questions. We want to answer as many as we can, and for that, I'm joined today by Dr. Ranit Mishori. She's professor of family medicine at Georgetown University School of Medicine and senior medical advisor for Physicians for Human Rights. Welcome, and thanks for being here, Dr. Mishori.
Thank you so much for having me.
So I want to get to as many questions as we can. Let's jump right in. The first one comes to us from Ingrid in California. She submitted her question via Instagram. Here's what she has to say.
Do you have to go through a complete decontamination routine every time you go out? I understand washing your hands, cleaning the doorknob, your keys, etc. But do you have to wash your clothes, take a shower each time you come back from the store?
What do you say to Ingrid? How careful do you have to be?
Well, you have to try to be as careful as possible, but I think you don't have to do all of that every time you step outside of the house. The key is that this virus is transmitted by being around other people. So if you have to go to work, if you're an essential worker and you work with a lot of people, you work at a store or you're a healthcare professional, yes, when you come home, take your clothes off, put them in the wash, jump in the shower. But if you go for a walk around the block or going to get groceries, you obviously have to wash your hands. You have to make sure that when you do go out, wear a mask to protect others. But showering and putting your clothes in the washer every time you step outside of the house, that's not necessary.
Here's another question about what's safe or not safe to do. This one comes to us from Claire Sullivan in Wisconsin. She submitted her question on Facebook, and she writes, I'm 67 years old. I still go to my son's house 5 mornings a week to help care for his baby. Both parents are working from home. Is this safe? What do you say, Dr. Mishori?
If you can stay home, stay home. If you don't have to take public transportation, do not take public transportation. Try to be as safe as possible.
So even if you're going to a family member's house, that's the only place you're going, caring for a grandchild, still wear a mask, take all those precautions if you can.
Absolutely. Take as many precautions as possible and understand that if you're around other people, you may get the virus and you may transmit it to people you come in contact with. And as I said, the ideal situation would be for you to stay home and not go out at all unless it's absolutely necessary.
Let's hear now from Jason Fuller. He submitted a video question via Instagram to us. Here's what he has to say.
My question is, for those who are experiencing mild symptoms, is there any particular self-care regimen that they should be doing?
Mild symptoms, we know a lot of people have them. What do you say to Jason?
Yes, a lot of people have them, and we tell them to stay home, which is exactly what he's doing. The question is, what do you do at home? The coronavirus, some of the symptoms, when they're milder, are like any other viral infection. So you would get some rest, you would drink a lot of water, you can take over-the-counter medications to help with pain, to help with fever. But the key is if you have the coronavirus infection, you want to isolate yourself at home. So you want to, ideally, if it's possible, to have your own room, to have your own bathroom, not to eat with other family members. So try to keep yourself in isolation.
We want to go to Jennifer Thomas. She submitted a video question via Facebook, and she wants to know about what happens if you catch the virus and recover. Here's her question.
If a person is officially declared recovered from COVID-19, can that person be an asymptomatic carrier of the virus later if exposed again?
It's a great question, Dr. Mishori. If you're sick, you recover, can you still pass the virus on to other people?
This is one of these excellent questions that we don't have an answer to just yet. At this point, what we know is that there are some very preliminary studies from China and from Korea showing that some people potentially can get reinfected after they've recovered. And then if they can get reinfected, they can also infect others potentially. There's a very big question mark about this. We also know that there are infections from asymptomatic people. So I think at this point, we don't have an answer for that.
Still so much we don't know. I do want to move on to a question from Mary Liz Town. She wrote in on our PBS NewsHour website with a question specific to her family. She asks, when will it be safe for my 83-year-old mom with underlying health issues and cognitive decline to leave her apartment?
I think one of the issues is the vaccine is probably not going to be available for another year, a year and a half. So for now, stay home. Later on, hopefully May, June, July, the models differ in terms of when the peak is going to take place in different cities and different states in the United States. So we have to be patient and wait. Hopefully not a year or year and a half sooner.
Hopefully not. One last question before we let you go, Dr. Mishori. This one comes to us from Janet. She's in New Mexico. She sent in a video on Facebook. Here's Janet's question now.
What is the permanent damage done to the lungs and heart by the virus?
Dr. Mishori, do we know what the long-term effects will be?
We're just beginning to find out because we have groups of people who are just recovering from very severe disease. What we do know is that the virus itself or the inflammatory reaction that is caused by the virus can cause damage and irritation to the lining of the lungs. Similarly, with heart disease related to COVID-19, we are now discovering that the virus or the inflammatory reaction is causing damage to the muscle itself. What's important to know is for people who have been in the ICU or have been ventilated for days or weeks, the recovery, regardless of long-term damage to the lungs or long-term damage to the heart, is going to be very long.
We're learning so much more every day. Dr. Ronit Mishori, thank you so much for taking some of these questions and providing answers today.
Thank you so much. I appreciate it.
And thanks to all of you for your questions. You can keep sending us more via NewsHour's Twitter, Facebook, and Instagram accounts, or on our website. That's pbs.org/newshour.